and myself are going to be talking about recovering from severe COVID-19 and some of the things that we've been working on with a group that we're running at UMSL's clinic. All right.
Yeah, thank you for that introduction. So essentially, just starting off a little bit about who we are. So we're graduate students of the Clinical Psychology PhD program at the University of Missouri St. Louis. I'm in the 4th year of the program, and Kelly's in the 3rd year of the program as well. So essentially, we're currently running a psychosocial rehabilitation group for individuals who have recovered from severe COVID. So a lot of group members would be those who were previously diagnosed with COVID-19 and spent at least 3 days in the hospital. This has been a group that we've kind of started in August, and is fully virtual and just happens over Zoom as well. And then let's see, we can go to the next slide. So just a quick overview of what we'll kind of be focusing on today. So we'll kind of just look at the post-acute effects of COVID-19. We'll talk about this thing called post-intensive care syndrome as well, and how that plays a role in a lot of the information and knowledge that we've kind of gathered. Ways a therapy group can help, what we've worked on in these therapy groups as well. So such things as coping with fatigue, managing loneliness, eating for brain health, memory strategies. Talk a little bit about lessons learned, things that we've kind of picked up on. We'll have some time for questions as well. Okay. And then let's see, next slide. So COVID-19 has pretty much been in the news, I would say, almost every day since the beginning of everything. But what we've noticed, and what me and Kelly talked about, is that the news tends to focus on things like rates of new cases, death rates, the importance of mask wearing and social distancing strategies to help keep us safe, whether or not the vaccine will be coming soon, when, and how effective it'll be. And sometimes you'll sort of see these political aspects of the virus kind of on news stations too. Me and Kelly, we've been fortunate enough to be involved in an area that isn't given a lot of coverage on the news, which is what people's lives look like after they've been hospitalized for COVID and they've survived. So I think it's an area that not many people think of unless they or a loved one have survived a hospitalization from COVID or are still experiencing long symptoms after their stay as well. So I just wanted to highlight that today's theme of the discussion will focus on the possible experiences of someone with COVID-19 and the possible road to recovery as well. And Kelly will tell you a little bit more.
All right. So there's a term that's been used to describe individuals who are showing effects long after they recover from the acute effects of the virus, or long after they're testing negative after they already had the virus. In the news, they've often been called COVID-19 long haulers. And these are individuals who experience effects of COVID-19 for 12 or more weeks after recovering technically from the acute effects. There's a lot of different chronic symptoms that go on after, COVID itself is no longer detected. And these are, various physical symptoms, emotional symptoms, and cognitive symptoms. I'll go into more detail on some of these things in just a minute here. One thing that has been in the news recently is that being a long hauler is not limited to individuals who have had a severe case of COVID-19. It's not limited to individuals who have been hospitalized. In fact, there have been some young people, some people who just had some mild symptoms who are now experiencing some of these long-term effects of COVID-19. It's not, most people who are experiencing long effects or anything like that. The numbers I saw, and there might be different numbers elsewhere, I saw probably about a third of individuals who are hospitalized are going to experience some of these long-term effects. And then I would assume it would be less for those who had mild symptoms, but I can't really give you a number on that. I'm not sure. So why do we see some of these lasting effects occurring in people who have recovered from COVID? appears that doctors aren't completely 100% sure on this, but there have been several theories on this. So it could be that there's a smaller form of the virus that is, remaining in the body and causing some of these effects. It could be that the immune system is overreacting. So I've seen a lot of things in the news or in the scientific literature about this cytokine storm, which is basically, a fancy way of saying your immune system is reacting more than it needs to fight off the disease, which is causing some of these long-term effects. Or it could be a specific type of chronic fatigue syndrome that we're seeing come up here, which is, I'm totally going to butcher this name, but myalgic encephalomyelitis and chronic fatigue syndrome coming up. And we know that about 80% of the ME/CFS cases are a result of some sort of infection. So it's very possible that COVID-19 is that infection that's causing this in this case. And the kind of fatigue, along with some of the brain fog that we're seeing in people who have recovered from COVID, are pretty consistent with this. So, any or all of these theories could be at play here. I'd like to note that you can see that there is a quote on the side here from an individual who has recovered from COVID. I think we have that a couple times in this presentation. And I just want to note that these quotes that we have are not from individuals in the group that we're running. These quotes are from people who were interviewed for a book that was recently published on COVID-19. And so they gave their permission to the author of this book to use their first name and stuff like that. So some of the post-acute COVID-19 effects that we're seeing, severe fatigue is a big one. Selmy will talk to us a lot more about fatigue later. Certainly some heart problems, some lung damage, which is obviously very consistent with the respiratory virus. And then some dizziness, some digestive problems, some brain fog, or what has been called in the news COVID-19 fog, same thing. And then some volatile emotions, a lot of shifting of emotions. Also, things like depression, anxiety, and PTSD are very common in COVID-19 survivors. All right, and so in a lot of the literature that we're pulling from as we try to understand what's going on with people who have recovered from COVID-19, so we're pulling from literature of people who have recovered from different types of illnesses in the past. And one thing that was around long before COVID-19 is something called post-intensive care syndrome, but it is still applicable to individuals who have been hospitalized for COVID-19. And this is when people experience new or worsening impairment in physical, cognitive, or mental domains persisting beyond the critical illness period, so beyond the period in which they spend in the ICU. It's very common for these individuals to experience things after they've been released from the hospital that are things like muscle weakness, fatigue, anxiety, depression, PTSD, memory loss or cognitive impairment, or difficulty with concentration. And it has been found that post-intensive care syndrome can persist for as long as 5 to 15 years. Obviously, that figure of 5 to 15 years did not come from the COVID-19 literature because COVID has not been around for that long. So we're not completely sure how COVID-19 plus post-intensive care syndrome plays out yet at this point. Some of the risk factors of developing post-intensive care syndrome if you have been hospitalized are being female, having a poor recall of your ICU stay, having a longer duration of sedation, and then having prolonged mechanical ventilation. Now, of course, with COVID-19, prolonged mechanical ventilation is pretty much synonymous with being sedated because all individuals who are on ventilation for a long period of time are sedated. And then having acute respiratory distress syndrome, experiencing sepsis or delirium while in the ICU. And then post-intensive care syndrome can also have an effect on family members who are taking care of the individual who is recovering from COVID-19. So family members, oftentimes end up being caregivers for a period of time for the person who's recovering. So survivors may need partial or total help with some of their activities of daily living. Activities of daily living is a fancy term that we use to mean things like dressing oneself, brushing your teeth, sometimes more complex tasks like shopping, cooking, cleaning, stuff like that. And caregivers, it's very common for them to experience stress, anxiety, and depression. They may have, experienced a change in roles. They may be providing care on top of working a full-time job, things like that. And there are some risk factors for developing mental health concerns as a family member. These would be things like being female, the patient being younger age, being the patient's spouse, the patient's illness coming on unexpected or sudden, which is usually the case with COVID-19, having the perception that the patient was at some point close to death, and then perceiving that the communication between the ICU physicians and the family was poor. All right, and so now we're back to talking about post-acute symptoms of COVID-19. Now, hopefully I made myself clear when I talked, kind of shifted between post-ICU syndrome and COVID-19. Post-ICU syndrome, not specific to COVID-19, can, apply to many different illnesses for which people are in the ICU. But of course, individuals with COVID-19 who are hospitalized can experience post-intensive care syndrome on top of the typical symptoms that people just with COVID-19 often experience after recovering from the disease. So I'd like to focus a little bit specifically on the cognitive symptoms that people sometimes experience after recovering from COVID-19, because these seem to be the ones that are most, surprising and bothersome for individuals. So like I said before, sometimes even survivors who have had milder cases or were not hospitalized can experience some of these post-acute symptoms of COVID-19. So I just threw some frequently asked questions on this slide, just specifically about the cognitive post-acute effects of COVID-19. So if we're thinking about what are some examples of the cognitive symptoms that people might experience after recovering from COVID-19, whether or not they were hospitalized, it might be things like forgetting names of people, trouble following along with conversations, and that of course requires someone's attention in the moment. So that may be an indication that there might be problems with attention after recovering from COVID. And then difficulty with planning and organizing. We have a fancy term for this called executive functioning, just meaning that, there's many things that we do throughout our day that require multiple steps, and the ability of someone to kind of think like, okay, I'm gonna make a meal, I need to think about all the ingredients I want, I need to think about the order in which I have to do this, things like that might be a little more difficult after someone has recovered from COVID and might be experiencing some of these cognitive effects. So again, why do they occur? So I know this came up earlier, but a theory is that the cytokine storms that I talked about earlier, which you'll recall that just is a fancy way of saying the immune system is going kind of crazy and is more active than it needs to be to fight off the virus itself. Those cytokine storms may lead to inflammation of the blood vessels of the brain, and that may be what leads to changes in the brain. So I'm not a doctor. It's possible that an actual doctor would tell me, no, actually new research has come out and this is wrong, but this is what I read in the literature. That's the thing with COVID-19, like there's new literature coming out all the time. So we always need to be flexible and willing to, explore different theories as the research is laid out. And then does COVID-19 cause lasting changes in the brain is something that people often want to know, especially if they experience these cognitive symptoms. So of course we don't have A for sure answer, COVID-19 is very new. The answer is possibly, and that is based on literature from SARS and MERS, which are other respiratory viruses that came along in the past that people recovered from. With these illnesses, about 40% of people reported psychiatric illness and 40% of people reported chronic fatigue years later. But of course, SARS and MERS are not the exact same as COVID-19. So one caveat here is that most SARS and most MERS patients were hospitalized, whereas with COVID-19, it's not most people that are being hospitalized for it. It's, of course, a large chunk, as we know, but it's not most people who contract COVID-19 end up in the hospital. So it's unclear if COVID-19, independent from hospitalization, will follow these same patterns of leading to lasting changes in the brain. All right, Selmy, I'll let you take it away from here.
Yeah, thank you so much for all that information, Kelly. So one thing we wanted to highlight a little bit was, ways a therapy group can help. Hopefully that table on the right side there is visible for you all, but I'll read it also just to help. But essentially, a recent research study examined the outcome of participants with COVID-19 who were admitted to the ICU. And they found that, even after 4 weeks after hospital discharge, these individuals had many needs, and table 1 here highlights some of these needs, such as physical and occupational therapy, mental health support with referral to counseling, psychology, or psychiatry, detailed cognitive evaluation with referral to comprehensive neurocognitive testing as needed, medication review and reconciliation, things like initiation or discontinuation, education of respiratory treatments such as inhalers and nebulizers, prescriptions for medical durable equipment, coordination of home health services for patients with physical impairments, referrals to specialists as well, and then also just coordination of care between providers. As you can see on that second bullet point, one of the listed needs is mental health support. And here are some possible ways that a therapy group can help in recovery. The first one is this piece about increased motivation towards goals. Some of the symptoms that Kelly kind of mentioned related to COVID, like fatigue and concentration difficulties, can affect motivation. And that's one way that a therapy group can help with recovery. Another aspect is this build your support system / people who understand. This can be achieved by having the opportunity to share your experience with other survivors of COVID-19 as well, and also working with a therapist as well and being able to share kind of your experiences. Another way a therapy group can help is kind of with this aspect of build skills and habits for a healthy lifestyle that will support recovery. In addition to some of the symptoms we talked about with COVID-19, because of the hospitalizations, things like sleep, pain might also be important things to want to help build on as well. And then lastly, another way that therapy group can help is with this option of exploring cognitive strategies for managing brain fog and ways to manage fatigue as well. So, thinking about what we've worked on in group and kind of going back to something Kelly said, there's limited research on therapy groups for COVID-19 recovery. We've essentially been structuring group from some of the cognitive rehabilitation literature that we've been able to read. But here are some examples of things we have worked on in group. First aspect is discussions on coping, allowing people to sort of discuss ways that they've been able to cope with their hospitalization and their experience with COVID-19. Talking about values, dealing with fatigue, also looking and talking a little bit about social relationships and managing loneliness, a great deal of brain health, so looking at things such as eating for brain health, and then also the importance of social engagement, physical activity, and other lifestyle habits in regard to brain health. And then also working on memory strategies. And I think an important thing for us to have a discussion about too is kind of normalizing this piece of medical issues that impact brain health and how recovering from a serious illness or injury can definitely impact brain health. And in this case, recovering from COVID-19 can impact brain health as well. So I mentioned the word values earlier, so I wanted to make sure that we kind of talked about that a little bit and how that can be important in the work with a therapy group. But essentially, everyone has values. Values are something that you try to live up to, essentially. They're similar to goals in that values shape your behaviors, but also different from goals in that they are not time limited. Values are something that you are truly never done with, but you sort of try to strive to always live by. So things like being a good parent, a good friend, being a hard worker can be values. And values, I would say, are important aspects of a meaningful life. They are definitely unique to each person. They can influence our choices and priorities in life. They can shape our personal strengths that we have built. Over a lifetime. They can help guide us as we manage life's challenges, especially overcoming a COVID hospitalization or experience with severe COVID. And then lastly, and very importantly, they can help us stay motivated as well. And especially for the recovery of COVID, motivation can be very helpful for many different things as well. And I'll kind of give you some examples of values at the moment also. But these are just a few. There's definitely more, but things like love of nature, art or music, courage to tackle life's challenges, curiosity and a love of learning, humor, love of family and friends. A lot of these values, highlighting these values in the therapy setting especially, can help people stay motivated, can help people allow to give themselves self-encouraging talks as well. It can definitely be helpful for this road to recovery. And then next, we'll sort of transition a little bit to dealing with fatigue. So fatigue, when we think of fatigue, at least in this aspect of COVID-19, we don't really want to think of fatigue as that aspect of we just worked a very, very long shift and we need a nap. We want to think of this more of this overwhelming sort of chronic aspect of fatigue. So fatigue can have a negative effect on mood, physical functioning, attention, memory, and communication and tolerance levels. If you look at this little diagram on the right there, what you'll sort of see is sort of this mental effort that we're kind of putting into things and that overloading feeling there. Can sort of start this vicious cycle in which mental effort leads to fatigue, which leads to impaired mental skills and irritation, which leads to more fatigue as well. And then when we think of fatigue, we think of it sometimes as just fatigue just in general, but it can be broken down to different types of fatigue. One can be physical fatigue, so the body needs to work harder to do things that were previously effortless. There's psychological fatigue. This is often associated with depression and anxiety and becomes worse with increased stress. There's also mental fatigue as well. This is caused by the extra effort it takes to deliberately think. Previously, automatic tasks now take more conscious effort to complete. And a good example of dealing with fatigue is this aspect of thinking of a gas tank to a car. So imagine somebody switching a car's fuel tank from a 12-gallon tank to an 8-gallon tank and not telling you, right? You would sort of imagine that you're still going to be able to do all of these things that you would usually do with a 12-gallon tank. However, now with the fatigue, it might be more of an 8-gallon tank. So what that would imply is it implies more of an opportunity to take rest breaks, to sort of be able to stop and take a rest as well and not sort of push yourself over the limit. And then when we think of some ways of coping with fatigue, there's definitely a lot of literature on different strategies for this. The first one is kind of this aspect of recognizing the early warning signs of when you're feeling fatigued, when it's becoming overwhelming, and to not keep pushing yourself as well. So kind of also pacing yourself as well, kind of not having to do every task right after the other, kind of pacing yourself throughout the morning and the afternoon and nighttime as well. Building in routine and structure can definitely be helpful as well. This means taking more time to plan for your day so that you're not kind of overdoing a lot of this effort that you have to participate in, and kind of just establishing that regular routine as well. And then gradually and slowly build up activities. Start with sort of familiar tasks that you're comfortable with, and then gradually increase some of that complexity of the tasks that you're involved in as well. Definitely sleeping and building in rest can definitely be helpful. It's finding a time to take a 45-minute nap or longer, whatever is kind of more suitable and comfortable for you. Kind of giving your brain that opportunity to rest is very important. One of the ones that I think is the most important is this ability to say no. Sometimes we can definitely have demands from, whether, in these cases, it could be friends, spouses, loved ones, children. They can definitely have a lot of demands for us to sort of participate in or help in. And sometimes it's okay to say no, that with this fatigue that you're dealing with, it's too overwhelming or it's too difficult to also participate in that. That kind of leads us to talking about, telling others. Sometimes it can be very helpful to be upfront with others and let them know about this difficulty you're having as well, and that you're also experiencing fatigue or suffering from it as well. Sometimes what might be a good strategy of coping with fatigue is sort of being a morning person, maybe being involved in the more demanding activities in the morning when you're kind of more alert and have a lot of energy might be helpful instead of waiting to do some of those more demanding tasks later on in the nighttime. Adding a little bit of regularity in regard to meals and exercise might be important as well. Eating regularly might be able to give your body that energy boost that it needs periodically throughout the day. And then exercise as well is something that can help improve your fatigue as well, especially when kind of done more consistently. And then treating your fatigue like a bank account. So thinking of kind of depositing money, withdrawing money as well. So thinking about the same way in regard to your energy levels also can be very important. And then sometimes, it's difficult to keep track of everything we have to do and everything that we have been doing. So sometimes keeping a diary can definitely be helpful. And this is just a way for you to record the activities you're involved in, and sort of figuring out, what's kind of increasing some of this fatigue, kind of where you can sort of plan or build in to help sort of rest as well. So those are just some ways of coping with fatigue. The other thing we wanted to definitely highlight in this presentation is how sort of dealing with COVID-19 affects social relationships, especially for individuals that have dealt with hospitalization. So one way or one aspect is this aspect of feeling disconnected. Individuals who are hospitalized due to COVID might not feel like they can relate to anyone else or share their experiences with other people and feel understood. So to some degree, they can feel disconnected, and that can make it difficult for them to engage in social activities with other people as well. And another aspect, which I think is very important, is this aspect of feeling stigmatized. Such that others might not want to be around someone else hospitalized due to COVID because they may feel like they are still contagious. And some people don't really want to feel stigmatized or experience any negative emotions or words from other people, so that might limit their social interactions with other people as well. Also talk a little bit about communication barriers on this next slide. This goes a little bit more so in hand with how some of those symptoms or experiences of COVID-19 might affect your ability to interact with other people. So Kelly and I both mentioned fatigue, but fatigue essentially may make it more difficult to maintain interest in a conversation or be able to communicate with others for as long as you would like. Attention might make it difficult to follow along with the conversation and be able to contribute to the conversation. Memory difficulties might make it difficult to contribute to the conversation and might also lead to feelings of embarrassment when someone has a difficult time remembering names of people or finding the right language or the right word for what they want to say. Physical functioning can be very important as well. Impairment of physical functioning might make it difficult for individuals to leave the house or travel to settings where they can communicate with others. And then lastly, and less talked about, it can be speech difficulty. For those that have been intubated for a long duration, it might have affected the tissue in the throat, and so they may not be able to talk as loudly as they like or for as long as they would like. And because of that, they might not want to interact with others as much because they're sort of self-aware about that. So kind of these difficulties in interacting with others can make people feel lonely or can affect their loneliness. So we'll talk a little bit about managing loneliness as well. So essentially, I picked up on a recent study that was done, and it kind of talked about how sufficient and early social support in recovery from COVID-19 may help improve individuals' difficulties with a lot of different things like sleep, depression, and anxiety. So we wanted to definitely highlight some ways people might be able to receive social support. One of the best ways is definitely family members or friends. This can be done both in person, whether you're living with somebody or you're sort of following safe protocols to maintain safety, or virtually as well. I think one of the awesome things today is that we're kind of having this session over Zoom, and I think that's awesome. So same thing with interacting with family members and friends, either in person or virtually can definitely be both important aspects. For some people who have suffered from severe COVID, they've had to go back to work after they've tested negative and they're healthy to return back to work. Coworkers can be a great source of social support as well, especially as you're trying to sort of get back into the habit of working. Religious organizations can also be a great source of social support. A lot of these might be virtual for the time being due to the pandemic, but the activities they have and the opportunities they provide can definitely be beneficial. Pets as well. Pets might help for a lot of different reasons, just being around you. And then also as you're kind of preparing with some of this physical functioning, as some of this muscle strength is coming back, taking a dog out for a walk or just playing with your pets can definitely be also a double added benefit there on top of the social support. Participating in hobbies and activities can also be a great source of social support. And then kind of like the main message and theme we've kind of been talking about today, therapy services can be a great source of social support too, particularly like the psychosocial group that we're talking about, being able to share your experiences with other people, being able to share your experiences with a therapist as well.
All right, so let's talk a bit about aspects of brain health that may be important to recovery. And these are things that we have talked a bit about in our group. So this diagram that I'm showing here comes from the rehabilitation literature or cognitive rehabilitation literature. And I'm not going to go through every item on this chart or anything like that, but I just want you to get a sense that there's a lot of different aspects that play into brain health. And I know, what's kind of popular in the media right now and what people often think when they think of, getting your cognition better is like brain games, brain games, brain games. There's been a lot of marketing on different types of cognitive training or brain games. And, a lot of people see that as kind of the end all be all of brain health because these companies do a really, really good job with their marketing. But as you can see here, there is a lot more than that plays into this. So, we do talk a bit about doing some cognitive training exercises in our group, but we certainly don't present it as like, this is the one thing you need to be doing. In fact, we present it as, if you are going to do any sort of brain games, find something that you enjoy, whether that be, crossword puzzles or Sudoku, something like that. You certainly don't need to pay to exercise your brain. You can find a lot of free resources. And then, with brain games, it's certainly not the situation where you should be isolating yourself from family members because you think you need to sit in a room by yourself and play brain games in order to make your brain better. That's actually, very far from the truth, because social networking is super important as well. It's really important to have, a rich social network. You can see that kind of on the left side of the diagram here. Exercise is, of course, really important as well. We do talk a bit about exercise in our group. Of course, we're very mindful of the fact that these individuals have recovered from a respiratory illness. We don't, need them to be going out and walking 3 miles at a time or anything like that, but we kind of just check in with what, their goals are for exercising, whether that be walking to the mailbox and back today, and then, walking a block next week or something like that. But of course, a lot of these individuals are already working with physical therapists who are on them about exercise as well. So that's, not the main focus of our work with them. And then you'll see something at the bottom in the center that says adherence to the Mediterranean diet. And it says Mediterranean diet specifically. There are actually several different what we call brain diets out there that are very similar to each other. And I'll talk a bit about them in just a second here. But as you can see, there's a lot of different things that play into overall brain health. So getting into, I promised you some information about different diets for brain health. Now you can see the term Mediterranean diet here, which was used on the last slide. That is a really popular one that, people eat as if they're kind of following those dietary habits of individuals living near the Mediterranean Sea. There's also something called the Nordic diet, which is very similar to the Mediterranean diet. And I promise this will make a lot more sense in the next couple of slides. I'm just kind of going through the terms that you'll hear here. There's also something called the DASH diet, which stands for Dietary Approach to Stop Hypertension. The MIND diet, which is a combination of the Mediterranean diet and the DASH diet. And it's an intervention for neurocognitive delay, which is really important for when we think about individuals who are at risk for like dementia or stuff like that. So I know I used a whole bunch of terms, and they're all, similar in a lot of ways with some very subtle differences. So I just want to talk about some of those similarities that you'll probably see across different brain diets. And that are things like including many plant-based foods in your diet. These diets encourage eating a lot of fish as a source of protein. They encourage whole grains over processed grains. They discourage saturated fat, of course, and processed foods. And they pretty much all of them state that red meat should be eaten only in moderation. And so in general with these diets, and now before I get into specific foods and stuff like that, I just want to note that, of course, I'm not a doctor, Selming's not a doctor. So we're presenting this information just based on what's in the literature. We're not saying, every single person needs to go eat like this right now. Of course, eating for brain health is great at any age, but we obviously understand that individuals have different health needs. Someone with diabetes should be consulting with their doctor regarding, what they should be eating, stuff like that. So yeah, presenting the information to you, but by no means saying this is the diet for you. Foods that are often encouraged regularly in all of these brain health diets are vegetables, especially leafy greens like spinach, berries, nuts, using olive oil while cooking instead of things like vegetable oil or butter, fish, beans, and then red wine if appropriate. Now, these diets are very mindful of the fact that some people choose not to drink alcohol for various reasons. So they're by no means saying start drinking alcohol if you don't, but they're saying if appropriate, a glass of red wine only one glass a day and no more than that can be beneficial for health. And then in general, these types of diets discourage the following foods or state that they should be eaten rarely: butter or margarine, cheese, red meat, fried foods, pastries and sweets, and processed grains. All right, so sorry, this is kind of a harsh transition here from eating, but we are now moving on to different types of memory strategies. And these, again, are some of the things that we've been working on in our group. You'll recall that different strategies are part of that cognitive training piece that was kind of on the upper right of that diagram that I showed you for brain health. So Selmy, I will let you take this slide from here.
Sure. Yeah, definitely. As Kelly mentioned earlier, one of the symptoms that we kind of see individuals suffering from COVID have experienced is difficulties with their cognition. And hopefully we'll learn a little bit more about that in these future months of more research being done as well. But we definitely thought talking about some of these memory strategies would be beneficial. This first slide here kind of just talks a little bit more about internal memory strategies, so things that we can do or try to do to help us with memory. As you can see, one of the ones listed here is repeat and rehearse. We've probably learned this throughout our schooling when we were younger, just kind of a vocabulary quiz or something, just rehearsing as much of that information and repeating it as much as we could. And that might work for some people, but it may not be the most effective for other people as well. So we wanted to make sure to list other strategies. So for example, if we were to think of trying to remember a grocery list of items when we're going to buy something, making visual pictures could help. So making visual pictures of the items on the list could be beneficial. There's this thing called chunking information. And essentially what that would do is to limit the information we're trying to remember or memorize into fewer categories. So that could help with grocery lists as well. And so can deeper level processing. So such as thinking about why certain items on the list are important and how those items will help create a certain lunch or dinner for you, for example. So those are just a few of the different strategies there as well. We've also got these other ones: make links and association, use mind maps, spider diagrams, make up stories or rhymes, or kind of go throughout the alphabet as well. And we'll do a little activity as well, give like a little demonstration. Depending on how impairing you find memory difficulties, on top of doing those internal strategies, external memory strategies are definitely very beneficial to help, especially things like a medication to set box to help with important things like medication. In regard to like our therapy group, we like to advocate for external memory aids in groups by asking group members to write things down during the session. It can be very easy to agree with the information at the moment and convince yourself to try to remember it, but it can be difficult to remember a lot of information in one sitting, and writing things down can help us remember better, definitely. So I think a combination of both internal and external memory strategies would be awesome to have in regard to battling that cognition difficulty that may arise from COVID-19. So that kind of transitions us to pretty much almost the end of our presentation. And so just a few things that we wanted to talk about in regard to this lessons learned is that being a COVID-19 survivor can feel lonely and isolating at times. There's different phases. There's that phase where you're initially feeling sick, that phase where you're hospitalized, that phase right shortly after the hospitalization discharge, and also the longer symptoms and consequences you can experience too. So one thing we wanted to just mention was how important it is for people that have or that are COVID-19 survivors to be able to share their experiences and talk about what they've gone through. And then how also important it is for us to not stigmatize others for catching the disease or being positive for the disease, and how harmful stigma can be and the negative effects it can have for people that are COVID-19 survivors or somebody who is positive for COVID as well.
All right. And then another thing we learned during our group, which is, certainly no surprise, is that no one's recovery is exactly the same. So people are coming to us, with different backgrounds, different values, and of course, different experiences, in the ICU and as they transition back home and in their path to recovery to this. So different strategies and skills will certainly be helpful to some people. And not to others, or basically like different strategies will be helpful to different people. So everyone comes each week and we give them a whole bunch of stuff, and it's probable that different people are finding different aspects of that more helpful. So one example of people's recovery not being exactly the same is we found that in the time of COVID-19, things are pretty isolating. And we found that some individuals were like, yes, I want to find ways to reconnect safely with others and integrate myself back into society. And other individuals were like, you know what? No, I'm good. I have an amazing support system with my family, and I'm not, that interested in reconnecting with others, which, is totally fine, given that, the family support system is already pretty strong there. And then one thing I wanted to highlight quickly is just some tips for if anyone has a family member who's recovering from COVID-19, especially severe COVID, and especially if they're experiencing some of these post-acute symptoms that we described today. And that is to be patient, of course. So recovery takes time and everybody's journey is different, as I said. Some individuals, like we talked about, may be experiencing word finding difficulties or other sorts of memory problems. So with regard to these memory problems, one thing to note is that recognition is always easier than free recall. And what we mean by that is if someone has something in their brain, they're trying to think about it. And this applies not just to people recovering from COVID or experiencing cognitive effects. This applies to every single one of us. Recognition is easier than free recall. So if we have something in our brain, it's so much easier if we're given like a multiple choice list to like pick like, yes, that one, than to generate that response on our own. So what this might mean if you have a loved one recovering is this might mean, maybe they're experiencing a lot of chronic fatigue and some memory problems. Rather than asking something like, oh, what should we have for dinner? And then they have to, go through their head of, okay, what are possible dinner options? What are possible things that I like? You might say something like, what should we have for dinner? We could have chicken or we could have fish. That's just going to make it so much easier to assess what those two things mean and pick, okay, yes, chicken, let's have that tonight. And then another tip is to be flexible. So, you might have plans to, I don't know, get something done around the house, to go grocery shopping, to Skype with family members, something like that. And sometimes things like chronic fatigue can derail those plans. The individual might just be too tired that night to carry out those plans. And then of course be validating. And, a lot of times with recovering from COVID, we see a lot of symptoms and emotions that may be unexpected. And one thing that I would like to note is that a lot of times, our tendency when someone expresses that they're struggling, our tendency might be to say, well, at least this, at least that. So if someone comes to you and says like, oh, I'm recovering from COVID, I'm just so tired, or, I just can't think straight, something like that. Our natural reaction, and it's totally a natural human reaction, is to say, oh, well, at least, you're still alive. At least you made it out of the hospital. You're one of the lucky ones. And I'm not saying that it's not good to be thankful or grateful for your life, but I'm just saying if you're using that as a statement to someone who's coming to you with struggles, it might be seen as a little bit invalidating. So a better way to respond to someone coming to you with struggles might be, saying things like, oh yeah, that sounds like it would be really difficult. Just kind of validating that, like, yes, you're experiencing these things and yes, they are real. All right, and then I also want to talk a little bit more about our group, just in case anyone who is watching, might be interested or might know someone who might be interested in our group. So what we do, so it's all over telehealth. People can choose to join via video or phone. We currently do it Tuesdays at 8:30 a.m. That doesn't mean that it always has to be Tuesdays at 8:30 a.m. If we, notice that there's a lot of interest, but people don't have that availability, we might think about changing the time in the future or having more than one session a week so that people, we can meet the needs of the public. Individuals who are recovering from COVID-19 who live in Missouri or Illinois are welcome to join. I know that specification of states probably sounds silly given that it's on Zoom, but with the licensure of the psychologists that we work under, just because of licensing laws, people need to live in Missouri or Illinois. And then we do have open enrollment for the group. So what that means is people can come and go at any time. We're very often kind of doing a recap of what we talked about the last week. So it doesn't seem like people are missing too much week to week, if they were to come in at a certain time. We'll also, hopefully find ourselves, restarting different groups as well. Let's see, and of course, kind of in the bottom here, you can see this box that I posted. We try to keep the fee as affordable as possible. It's an income-based fee. So people are paying $5 to $15 per session just based on their income. We also do allow and encourage a family member to join each patient at no additional charge. We certainly don't require it or anything like that, but we just want to, make sure people feel like they can have a support person with them. And like I said, it's all adults recovering from moderate to severe COVID-19. I believe our specifications for moderate to severe have been individuals who have spent 3 or more days in the hospital. However, I do acknowledge that I talked earlier in the presentation about the fact that some people, even with mild symptoms, are experiencing some of these intense post-acute effects of COVID. So if someone maybe doesn't meet the hospital 3-day requirement, but maybe is still experiencing these symptoms, I would still give us a call and see if we can work with you on that. And then I posted the number at the bottom here, so feel free to write that down, take a screenshot, whatever, just so that you have the number in case you're interested or know someone who may be. All right. And references, because we're grad students, it's what we're used to. And we just want to open it up now for questions. What questions can we answer for people who have been watching?